Good afternoon, everyone. I'm Dr. Malathi. Today, my topic is visually handicapped certificates to evaluate the causes for the permanent visual impairment at GGH Anantapuram. Introduction. Globally, 2.2 million people have a near or distant visual impairment. 1 billion of these visual impairment could have been prevented. The leading causes of visual impairment and blindness at a global level are refractive errors, cataract, diabetic retinopathy, glaucoma and ARMD. Visual impairment suggests both low vision and blindness. Among these 1 billion people, the main conditions causing distant visual impairment or blindness are cataract 94 million, refractive error is 88.4 million, age-related macular degeneration is 8 million, glaucoma is 7.7 million, diabetic retinopathy is 3.9 million. The main condition causing near visual impairment is presbyopia, that is 826 million. According to the ICD-9 of WHO, the low vision is category 1 and 2. It is a visual acuity of less than 6 by 18 but equal to or better than 3 by 60, or corresponding visual loss is less than 20 degrees in the better eye with the best possible correction. Blindness is category 3, that is visual acuity of less than 3 by 60 or a corresponding visual field loss is less than 10 degrees in the better eye with the best possible correction. Social services for the visual disabled are coordinated on the basis of certification for blindness or visual disability. The registration as blind or visually disabled in India is purely voluntary. Based on this severity, a constituted board including an ophthalmologist, a physician and the chairman of the medical board recognizes and certifies the visually disabled person in India. Aims and objectives. To analyze the various causes of visual impairment among the patients attending for the visual handicapped certificate at GGH Anantapuram. Material and methods. Type of study is retrospective study on the basis of medical records and Sadaram applications who had applied for the visual handicapped certificates. Place of study is GGH Anantapuram. Type of study period is 1 year, that is June 2022 to May 2023. Sample size is 543 patients at the age group of 10 to 55 years. Inclusion criteria: a person to be visually impaired if visual acuity could not be corrected to the normal level. Category 0 is 0, that is 20% disability. Best corrected visual acuity is 6 by 9 to 6 by 18 in the better eye. Category 1 to 4 is 1 to 4, that is 40 to 100% disability came under the visual handicapped. One-eyed were given at 30% disability. Vision in the better eye is 6 by 6. Worse eye is counting finger at 1 meter to no perception of light. Exclusion criteria is treatable causes like refractive errors without amblyopia, cataract, and amblyopia following cataract surgery in children below 15 years were excluded. Examination was done in both eyes, that is history taking regarding symptoms, duration of disability, visual acuity testing by Snellen's chart, slit lamp examination for anterior segment evaluation, IOP measurement to rule out glaucoma, fundus examination to rule out posterior segment pathology, and B scan was done. Results showing distribution of the patients according to the visual impairment. Study involved 543 patients with the age group of 10 to 55 years. Out of them, 92 cases are resected. Visual impairment mild is category 1 and 2, that is 262 patients are number of individuals are involved. Moderate is category 3, that is 118 individuals are involved. Severe is category 4, that is 71 individuals are involved. Distribution of the patient according to the sex, males are more commonly involved than females. Distribution of the patients according to the diagnosis, retinitis pigmentosa, that is more common people involved, that is 92 people are involved, and retinal detachment is least commonly occurred. Discussion: in this study, retinitis pigmentosa is the most common cause, followed by optic atrophy, corneal opacity, pathological myopia, macular diseases, amblyopia, glaucoma, phthisis bulbi, empty socket, nystagmus, retinal detachment respectively. Other causes including hereditary diseases, eviscerated eye, trauma and ocular tumors. There is a connection between the requirement of visual handicapped certification for the educational and work purposes and the increase in the registration among the males. In this research, there were significantly more males than females. This is similar to the other studies that is K.S. Raju Krishna et al. And Joshi et al. Visual impairment is an important public health issue, mainly in the developing countries, as it impairs the quality of life, limits the career choices and job opportunities, thus constituting a social economic burden in the society. People with disability of 40% or more are considered as a visual disabled or handicapped and entitled a lot of government benefits such as reservation in colleges, jobs, travel concession, income tax benefits and various other disability benefits. Hence, there were many applications of these certificates. Conclusion, the study analysis shows the leading cause of visual impairment is retinitis pigmentosa. Avoidance of consanguineous marriages and genetic counseling should be made mandatory to prevent blindness to rule out retinitis pigmentosa. These are my references. Thank you.